Mark Jones, and I'm going to tell you a bit about my course, Clinical Reasoning, Fast and Slow Reasoning in Musculoskeletal Practice. Consider this scenario. I saw a patient with one of my postgrads recently, and the patient reported having mid-thoracic pain that was consistently provoked whenever he sat to eat lunch. The student clarified that he typically sits in a slouched posture, and then in his physical examination, he found thoracic stiffness, both in physiological and accessory movement testing. The patient was also tender in the area of the pain. So he concluded from that the source of the patient's symptoms was these stiff thoracic joints and wanted to proceed to treat these. Does that sound familiar? Does it sound reasonable? Well, in the end, the student was very, very wrong. Can you see any errors in this reasoning? We'll talk about this on the course. We all think, we all analyze, we all make clinical judgments. The question is, how well do you do this, and could you do it better? Most people don't think about their thinking. That is, they don't critically consider their own thinking processes, and therefore are less likely to improve these. However, there are many common errors in clinical reasoning. For example, biased judgments that come from the diagnosis provided on a referral, being biased by the imaging findings, or just favorite hypotheses. Making assumptions by not clarifying the meaning that patients have in their answers to questions. Not thoroughly screening, for example, for other symptoms, other aggravating factors, red flags, psychosocial factors, and not testing alternative hypotheses to rule these out. All of these are common errors in clinical practice. Now, greater awareness of your own clinical reasoning, especially errors caused by habitual, non-critical thinking, will improve your reasoning and decision making. And this is what we'll achieve through this course. We know from research that experts in all professions can make good, fast decisions using pattern recognition, or what I call fast reasoning. On the other hand, reasoning too fast is the primary source of most reasoning errors. This 2-day clinical reasoning course will provide you with a thorough overview of clinical reasoning to help you better understand your own reasoning, your diagnostic focused and your psychosocial focused reasoning. I'll integrate reflective participant discussions throughout the course to enhance your understanding of key categories of clinical judgments you need to make in clinical practice. And we'll work through 2 real patient cases to practice both diagnostic reasoning and psychosocial focused reasoning.